Now, how are you going to basically clinically evaluate these patients of hydrocephalus? It's again very interesting. And sign and symptoms that you're going to observe, the patient is going to come up to you with a different set of sign and symptoms. In the adults, there is a completely different clinical picture. And then in the younger individuals or in the neonates and the children, we have a different clinical picture that is being observed. Just to remember the key features that are present in patients of the hydrocephalus, they can be remembered by the alphabets. For instance, the A, B, C, D, E, and F stands for the different basic clinical features observed in these patients. Starting off with the A, we have an accelerated rate of head growth that is observed for these particular patients. So basically the diameters, whenever the neonates come up for even the normal visits, we usually try to measure the diameter, the biparietal diameters, and the head circumference is taken for, and there are these particular A charts that we usually refer to when we are examining even the normal neonates. So when these patients would come up to you in the clinics, you would observe this particular phenomena, that there is an accelerated rate in which the head circumference is growing. So this is one of the key feature, which is basically pointing out towards the fact that the neonate is suffering from an increased intracranial pressure. Now, the B over here stands for the bulging anterior fontanelles. And we all know that basically the anterior fontanelle starts to close up at almost a year, and it may take almost a year and almost 2 or 3 months for the anterior fontanelle to close. So there is this soft palpable portion that is present anteriorly, and if it is bulging, if this anterior fontanelle is bulging, it is again one of the clicking factor that the patient has an increased intracranial pressure. So you have to note that down as well if you are suspicious of this particular fact. Then we have the cranial suture, which is separated. So even it can be related to the fact that if there is a failure of the anterior fontanelle to close even after a year, so that is again one of the fact. And again, if there is the cranial suture which is also separating apart from the anterior fontanelle, that is again one of the factors that is indicating that there is a back pressure or there is a hydrostatic pressure that is present in the neonate or in the child. The dilated scalp veins are also quite visible, and particularly they are again indicative of the hydrocephalic condition in the neonate. The E over here stands for the eyes. So the eyes are quite detonating, and you would see a sunset appearance which is noted down in the eyes. There is a downward deviation, and the sclera is usually quite visible around the pupil. And this sunset appearance and this downward deviation or a downward gaze in the child is again indicative of an increased intracranial pressure. The F over here stands for the forehead. So you have to focus on the forehead as well. And there is the enlargement of the head. There is the bulging veins that are present. And again, the signs of the anterior fontanelle, the failure of the anterior fontanelle to close down, are all basically focusing on the head of the neonate or the head of the child. And there is going to be the broadening of the forehead as well noted down over here. So all of these key features have to be kept in mind. And this is a classical picture of a hydrocephalic child when he or she presents to you in the outpatient department. So this is these are the A, B, C, D, E, and Fs that you have to remember when you are clinically examining the child, and you have to focus on all of these points, and then obviously start off with the investigations further on. The physical appearance is sort of like this. Over here, you can basically focus on the fact that we have an enlarged head size in both of these pictures, clearly showing an enlarged head size. There is the separation of the cerebral sutures noted down. The anterior fontanelle may fail to close down. The sunset appearance of the eyes is indicative of the fact the sclera is quite visibly seen over here, and there is a downward gaze over here noted down in the patient. Again, there is a massive increase in the head size as well, which is again one of the factors which is quite expressive and would be very easy for an individual to diagnose that this patient is suffering from hydrocephalus. Then obviously the broadening of the forehead and the bulging of the veins on the forehead is also noted down laterally when you examine the patient. And the patient is overall going to have the general features of irritability. The child is going to basically feature the irritable signs noted down. All of these are basically noted down and documented in detail. Now, in infants particularly, we'd focus on the scalp veins dilated, and they're usually non-pulsatile, as you can even observe over here. We have a McEwen sign, which is noted down. It's basically an inappropriate light reflex that is noted down in the individuals. The setting sun or the sunset appearance in the eyes, which is basically the downward gaze in the child, and then the sclera is very prominent superiorly. So this is known as the setting sun sign in the child. Then we have the frontal bossing. This is basically the enlargement of all of these impressions. This is known as the frontal bossing with the depressed eyes. So the downward gaze is also associated with the frontal bossing, and it's due to the enlargement or the broadening of the forehead that this frontal bossing or the appearance is more likely of the sunset appearance. Now, the sutures can be palpably separated. So even the anterior fontanelle, it fails to close in a lot of patients. And then in these patients, all of these sutures, this is the sagittal suture, then we have the coronal suture, then we have the parietal suture, the temporal suture. All of these sutures can be visibly separated, and even on palpation, you can observe that there is a slight separation of the sutures overall in the vault of the patient. Now, sometimes whenever there are signs of this irritability observed in these patients, the patients might observe this particular position, which is known as opisthotonus. This is due to the increased irritability. Even the meningitis can lead to this condition of opisthotonus. What happens over here is there is the contraction of the muscles at the back, and this position is attained, which is known as the opisthotonus position by the neonate. The changes in the level of consciousness, and it can even go out towards the depression of all of the central nervous system, and basically it can lay forward towards the levels of consciousness to be altered in the individual. There is the sluggish responses of the pupils also observed in these particular patients. Now, moving on, we have the unequal responses to light. The light reflexes, the pupillary dilatation is not usually observed in these particular patients. They feed poorly, so this is going to be the particular history which is given by the mother or the caretaker, that the patient or the neonate is basically not feeding properly, and he's quite irritable all the time, cries when picked up. The lower extremity, it shows spastic signs as well. For instance, the Babinski sign is observed over here at the plantar aspects. When you basically rub any sharp pointed object over here at the plantar aspects, the toes are going to exhibit the fanning response. And this is known as Babinski's sign, which is basically positive in these patients of hydrocephalus. Now, when the disease progresses, what would be the signs and symptoms if they're not treated properly? There's going to be a shrill, brief, high-pitched cry in the patients due to increased levels of irritability. Cortex is destroyed. There can be the increased episodes of vomiting, projectile vomiting usually, which is known as emesis in the patients. Solemnness, so there's going to be that constant appearance of that particular emotional phase when you look at that particular neonate. The seizures, they might be present in the patient feels quite irritable all the time. Papil edema is one of the feature. Basically, when you observe the retina through an ophthalmoscope, you can basically suggest the fact that the patient has papil edema. Then we can have the strabismus, that is basically the squinting phenomena observed in these patients. Headache is one of the major signs and symptoms observed, and then the patients might have the cardiopulmonary distress that is being observed for these particular patients eventually. Now, overall, this diagram is basically going to be quite helpful for you when you're basically focusing on the overall clinical features over here, ranging from the confusional statuses of the child. Patient might be suffering from cranial nerve palsies. We know that basically the cranial nerves are directly coming out of the brain. We have basically the 12 pair of cranial nerves that have their particular functions to perform. So whenever there is going to be an increased intracranial pressure, it might basically affect these cranial nerves, and obviously the facial palsies or the vestibulocochlear palsies might exhibit in these particular patients accordingly. Bulging occiput is one of the signs that is observed in these patients. Nystagmus, it's basically the oscillatory movements of the pupils that are observed in these particular patients. And the child is going to exhibit an overall lethargic attitude when you examine him. Ataxia, that is the uncoordinated movements, are also observed in these children. They're going to be found incoherent, and they're going to babble words which are basically not comprehensible at all. Apathetic is again one of the features observed for these children. So this is going to be an overall complete or a classical clinical picture in a neonate who is suffering from hydrocephalus.